Hello, this is Dr. Alan Wegg with OCD Tip number 2, Scheduled versus Serendipitous Exposure Therapy. There are two approaches to engaging in exposure therapy, and in a good, rigorous ERP program, you should really use both. In scheduled exposure therapy, sometimes called structured or formal exposure therapy, exposure is designed as a sort of a homework. At a particular place and at a particular time, I'm going to engage in my ERP practice for a particular period of time. So, for instance, at 7 p.m. each night, I'm going to spend 20 minutes walking around the house, touching things that feel contaminated to me and not washing my hands. Or alternatively, at 10 a.m. Every morning, I'm going to get in my car and drive around the neighborhood and practice not looking in the rearview mirrors or driving back to make sure that I didn't hit somebody and not retracing my driving steps. I do these things each day as scheduled, slowly increasing my level on the hierarchy so that I'm touching things that are more highly contaminated over time, and I'm traveling in my car in areas that have more and more pedestrians walking around. In addition, you should also be engaging in serendipitous exposure therapy, sometimes called unplanned or spontaneous exposure therapy, where over the course of the day, when unexpected triggers make you feel anxious because of your OCD, you take those opportunities to challenge yourself and engage in some kind of exposure experience. So for instance, let's say you go to a local store and on a particular day, the automatic doors are not working and you have to open up the doors yourself. Take that opportunity to actually use your hands to open up the door and not wash your hand, of course, rather than using your elbow or slipping your hand into the sleeve of your sweater and then opening the door using that. In our other example, you're driving the car going to work and hit an unexpected bump. Use that opportunity to, let's say, make a deal with yourself that you're just going to look in the rearview mirror once and you're not going to turn the car around to check to see if you've hit somebody. The idea is to do both kind of exposures, because in scheduled exposures, you have the opportunity to use repeated measured exposures to strengthen your ability to challenge your OCD anxiety. While in serendipitous exposure, you have the opportunity to build your resilience against unexpected, unplanned exposure triggers. Working together, these two methods provide a rounded, stronger exposure experience. This is Dr. Alan Wegg. See you next time on OCD Tips.